Mathieu Guérin is a cybersecurity expert at Wavestone. He joins me now to talk a bit more about all of this. Mathieu, thank you for speaking to us. Let's start with what we just heard there at the end of that piece. Cyber attacks targeting hospitals have been increasing in France, up 70% from 2 years ago. Why?
Well, hello everyone. So first I would say because hospitals have very diverse and complex information systems. On top of usual servers and workstations, you will find a lot of very specific systems. Think about imagery equipments, for example, X-ray machines or CT scanners. They're all off the shelf, managed by the suppliers, and it's really hard to maintain the right level of security on those equipments. And then hospitals are very attractive for attackers. One of the person was saying this. It's very attractive because they think that it will be easy to get the money from the ransom because the impacts can be quite massive. Blocking emergencies or imagery equipments can sometimes be a matter of life or death. And they know that they can increase the pressure on their victim just by leaking specific data, just like patient data. Of course, it can be really critical. So all of those factors do that hospitals are really attractive for attackers.
It doesn't seem like that's working out for the hackers. I mean, this breach dates to Saturday. The hackers have asked for $10 million, and the hospital says it's not going to pay so far. So how would this play out? What happens next, do you think?
I think nothing will happen next for the hackers there's kind of an official statement defined by the national agency in France, which is we just don't pay. But the thing is that those hackers are really international. We don't really know where they're coming from, and they're trying to hit as much victims as possible, and maybe they didn't even know about these official statements. In many different countries in the world, we've seen medical care centers paying ransoms, and they're just trying.
Medical data, you were saying before, can be sold. We heard in our piece earlier, can be sold for about 300 euros per file. Who would pay that much money for that data, and what would they do with it?
Honestly, I don't think here it's an attack where they will try to resell the data. Here it's quite classical, what we call ransomware attacks, where they try to extort you, to get a ransom from you. So what they're doing is like, they're saying, if you don't pay us this $10 million, then we will publish this data or we will give them to someone. But they're trying to get the money from the hospital and not by reselling the data. This is how they usually work. But then maybe they have something else in mind. But frequently, this is how it works.
So what can hospitals, other hospitals, or anyone for that matter, do to truly protect themselves from this kind of hack?
Well, there are lots of things. You know that in France there are $300 million in the post-COVID investment plan that were dedicated to securing the hospitals. So there are many things you can do around securing those. The attacks are not necessarily so complex. We know how they come from. It's vulnerabilities on the internet-facing equipment, or simple phishing, like people clicking on the wrong email. So there's awareness. There's a lot of things like classical, I would say, cybersecurity projects that can be done by the hospitals, and that will be done, that are currently done. A lot of assessments are going on now. Cybersecurity assessments are going on in all the hospitals in France.
All right, Mathieu, thanks for that. Mathieu Guérin, cybersecurity expert at Wavestone. Thanks for talking to us.